Hi Mark, I'm Mitch from the A class and my number is 39. I'm going to start the record this week. Depression symptoms and warning signs. The normal ups and downs of life means that everyone feels sad or has the blues from time to time. But if emptiness and despair have taken hold of your life and won't go away, you may have depression. Depression makes it tough to function and overwhelming, but no matter how hopeless you feel, you can get better. Understanding the signs, symptoms, cause, and treatment of depression is the first step to overcoming the problem. What is depression? Sadness or downswinging in the mood are normal reactions to life struggles, setbacks, and disappointments. Many people use the word depression to explain these kind of feelings, but depression is much more than just sadness. Some people describe depression as like living in a black hole or having fear of impending doom. However, some depressed people don't feel sad at all. They might feel lifeless, empty, and apathetic, or men in particular may even feel angry, aggressive, and restless. Whatever the symptom, depression is different from normal sadness and in that it engulfs your day-to-day life, interfering with your ability to work, study, eat, sleep, and have fun. The feelings of happiness, hopelessness, and worthlessness are intense and unrelenting with little or if any relief. Are you depressed? If you identify with severe of the following signs and symptoms and they just won't go away, you may be suffering from clinical depression. You can sleep or you sleep too much. You can concentrate or find that previously easy tasks are not difficult. You feel hopeless and helpless. You can control your negative thoughts, no matter how much you try. You have lost your appetite or you can't stop eating. You are much more irritable, short-tempered, or aggressive than usual. You are consuming more alcohol than normal or engaging in other reckless behavior. If you have thoughts that life is not worth living, seek help immediately if this is the case. What are the signs and symptoms of depression? Depression varies from person to person, but there are some common signs and symptoms. It's important to remember that these symptoms can be part of life normal law. But the more symptoms you have, the stronger they are, the longer they've lasted, the more likely it's that you're dealing with depression. When these symptoms are overwhelming and disabling, that's when it's time to seek help. Signs and symptoms of depression include feelings of helplessness and hopelessness, a bleak outlook, nothing will ever get better, and there's nothing you can do to improve your situation. Loss of interest in daily activities, no interest in former hobbies, pastimes, social activities, or sex. You've lost your ability to feel joy and pleasure. Appetite or weight changes, significant weight loss or weight gain, a change of more than 5% of body weight in a month. Sleep change, either it's insomnia, especially waking in the early hours of the morning or oversleeping, also known as hypersomnia. Anger or irritability, feeling agitated, restless, or even violent. Your tolerance level is low. Your temper is short and everything and everyone gets on your nerves. Loss of energy, feeling fatigue, suckless, and physically drained. Your whole body may feel heavy and even small tasks are exhausting or take longer to complete. Self-loathing, strong feelings of worthiness or guilt. You harsh criticize yourself from persevered faults and mistakes. Restless behavior, engage in escapist behavior such as substance abuse, compulsive gambling, reckless driving, or dangerous sport. Depression and suicide. Depression is major risk factor for suicide. The deeper despair and hopelessness that goes along with depression can make suicide feel like the only way to escape the pain. Thoughts of death or suicide are the serious symptoms of depression, so take an suicidal talk or behavior seriously. It's not just a warning sign that the person is thinking about suicide, it's a cry for help. Warning signs of suicide including talking about killing or harming oneself, expressing a strong feeling of hopelessness or being trapped, an unusual preoccupation with death or dying. acting recklessly as if they have a death wish, speeding through red lights, calling or visiting people to say goodbye, getting affairs in order, giving away prized possessions, trying up loose ends, saying things like everyone would be better off without me or I want out. A sudden switch from being extremely depressed to acting calm and happy. If you think a friend or family member is considering suicide, express your concern and seek professional help immediately. Talking openly about suicidal thoughts and feelings can save a life. If you are feeling suicidal, when you feel extremely depressed or suicidal, problems don't seem temporary, they seem overwhelming and permanent, but with time you will feel better, especially if you reach out for help. If you are feeling suicidal, know that there are many people who want to support you during this difficult time, so please reach out for help. The face of depression. Depression often looks different in men and women and in your young people and older adults, and awareness of these differences have ensured that the problem is recognized and treated. Depression in men. Depression is a loaded word in our culture. Many associate it, however wrongly, with a sign of weakness and excessive emotion. It is especially true with men. Depressed men are less likely than women to acknowledge feelings of self-loathing and hopelessness. Instead, they tend to complain about fatigue, irritability, sleep problems, loss of interest in work and hobbies. Other signs or symptoms of depression in men include anger, aggression, violence, reckless behavior, and substance abuse. Even though depression rates for women are twice as high as those in men, men are in higher suicide risk, especially older men learn more. Depressive in women. Rates of depression in women are twice as high as they are in men. This is due to part to hormonal factors, particularly when it comes to premenstrual syndromes, premenstrual cyphoric disorder (PMDD), postpartum depression, and perimenopausal depression. As for signs and symptoms, women are more likely than men to experience pronounced feeling of guilt, sleep excessively, overreact, and gain weight. Women are also more likely to suffer from a seasonal affective disorder. Depression in teens. While some depressed teens appears that others do not. In fact, irritability rather than depression is frequently the predominant symptom in depressed adolescents and teens. A depressed teenager may be hostile, grumpy, or easily lose his or her temper. Unexplained aches and pains are also common symptoms of depression in young people. Left untreated, teen depression can lead to problems at home and school, drug abuse, self-loathing, even irreversible tragedy such as homicidal violence or suicide. But with help, teenage depression is highly treatable. Depression in old adults. The difficult change that many old adults face, such as bereavement, loss of independence, and health problems, can lead to depression, especially in those without a strong support system. However, depression is not a normal part of aging. Older adults tend to complain more about the physical rather than the emotional signs of symptoms of depression, and so the problems are often goes unrecognized. Depression in older adults is associated with poor health, a high mortality rate, and an increased risk of suicide, so diagnosis and treatments are extremely important. Postpartum depression. Many new mothers suffer from fleeting form of baby blues, postpartum depression. In contrast, is longer-lasting and more serious depression, triggered in part by hormonal changes associated with having a baby. Postpartum depression usually develops soon after delivery, but an expression that occurs within 6 months of childbirth may be postpartum depression. What are the types of depression? Depression comes in many shapes and forms. The different types of depression have unique symptoms, cause, and effects. Knowing what types of depression you have can help you manage your symptoms. Major depression. Major depression is characterized by the inability to enjoy life and experience pleasure. The symptoms are constant ranging from moderate to severe. Left untreated, major depression typically lasts for about 6 months. Some people experience just a single depression episode in their lifetime, but more commonly, major depression is a recurring disorder. However, there are many things you can do to support your mood and reduce the risk of recurrence. Dysthymia, recurrent and mild depression. Dysthymia is a type of chronic low-grade depression. More days than not you feel mildly or moderately depressed, although you may have brief periods of normal mood. The symptoms of dysthymia are not as strong as the symptoms of major depression, but they last a long time, at least 2 years. These chronic symptoms make it very difficult to live life to the fullest or to remember better times. Some people also experience major depressive episodes on top dysthymia, a condition known as double depression. If you suffer from dysthymia, you may feel like you've always been depressed, or you may think that your continuous low mood is just the way you are. However, dysthymia can be treated even if your symptoms have gone unrecognized or untreated for years. Bipolar disorder, when that depression is just one side of the coin. Bipolar disorder, also known as manic depression, is characterized by cyclic mood change. Episodes of depression alternate with manic episodes, which can include impulsive behavior, hyperactivity, rapid speech, and little to no sleep. Typically, the switch from one mood extreme to the other is gradual, with each manic depression episode lasting for at least several weeks. When depression, a person with bipolar disorder exhibit the usual symptoms of major depression. However, the treatment for bipolar depressions are very different. In fact, antidepressants can make bipolar depression worse. Seasonal affective disorder. When winter brings the blues, many people feel sad when winter wanes. But some actually develop depression with the seasons change, known as seasonal affective disorder (SAD). This form of depression affects about 1% to 2% of the population, particularly women and young people. SAD seems to be triggered by more limited exposure to daylight. Typically, it comes on during the fall or winter months and subside in the spring. To combat SAD, doctors suggest exercise, particularly outdoor activities during daylight hours. Exposing yourself to bright actual light may also help. Light therapy, also called phototherapy. Phototherapy usually involves sitting close to a special light source. Is that far more intense than normal indoor light for 30 minutes every morning. The light must enter through your eyes to be effective. Skin exposure has not been proven to work. Some people feel better after only one light treatment, but most people require at least a few days of treatment and some need several weeks. You can buy boxes that emit the proper light intensity, 10,000 lux, with a minimal amount of or
ultraviolet light without a prescription, but it is best to work with a professional who can monitor your response. There are few side effects to light therapy, but you should be aware of the following potential problems. With anxiety, jitteriness, headaches, early awakening, or eye strain can occur. There is evidence that light therapy can trigger a manic episode in people who are vulnerable. There is evidence. While there is no proof that light therapy can aggressive and eye problem, you should still discuss an eye disease with your doctor before starting light therapy. Likewise, since what rashes can result, let your doctor know about any skin condition. Some drug or herbs, for example, St. John's wort, can make you sensitive to light. Depression cause and risk factors. Some illnesses have a specific medical cause, making treatments straightforward. If you have diabetes, you take insulin. If you have appendicitis, you have surgery. Depression, however, it's more complicated. Depression is not just the result of the chemical imbalance in the brain, and it's not simply cured with medication. Experts believe that depression is caused by a combination of biology, psychology, and social factors. In other words, your lifestyle, choices, relationships, and coping skills matter just as much, if not more so, than genetics. However, certain risk factors may make you more vulnerable to depression. Cause and risk factors for depressions: loneliness, lack of social support, recent stressful life experience, family history of depression, marital or relationship problems, financial strain, early childhood trauma or abuse, alcohol or drug abuse, unemployment or underemployment, health problems or chronic pain. The road to depression recovery, just as the symptoms and cause of depression are different in different people, so the way to feel better, what works for one people might not work for another, and no one treatment is appropriate in all cases. If you recognize the sign of depression in yourself or a loved one, take some time to explore the many treatment options. In most cases, the best approach involves a combination of social support, lifestyle changes, emotional skills building, and professional help. As for help and support, if even the thought of tackling your depression seems overwhelming, don't panic. Feeling helpless and hopeless is a symptom of depression, not the reality of your situation. It does not mean that you're weak or you can't change. The key to depression recovery is to start small and ask for help. The simple act of talking to someone face to face about how you feel can be an enormous help. The people you talk doesn't have to be able to fix you. He or she needs to be a good listener. Having a strong support system will speed your recovery. Isolation fuels depression, so reach out to others even if you feel like being alone or don't want to feel like a burden to others. The truth is that most people will be happy that you choose to confide in them. They'll be flattered that you trust them enough to open up, so let your family and friends know what you're going through and how they can support you. Make healthy lifestyle changes. Lifestyle changes are not always easy to make, but they can have a big impact on depression. Lifestyle changes that can be very effective include cultivating supportive relationships, getting regular exercise and sleep, eating healthy food to narrow or boost mood, managing stress, practicing relaxation techniques, challenging negative thoughts patterns. Build emotional skills. Many people lack of skills needs to manage stress and balance emotion. Building emotional skills can give you the ability of cope and bounce back from adversity, trauma, and loss. In other words, learning how to recognize in depression. Trauma. Recognize and express your emotion can make you more resilient. Seek professional help if support from family and friends, positive lifestyle changes, and emotional skills building aren't enough. Seek help from a mental health professional. There are many effective treatments for depression, include therapy, medication, and alternative treatments. Learning about your options will help you decide what measures are most likely to work because best for your particular situation and need. Effective treatment for depression often includes some for therapy. Therapy gives you tools to treat depression from a variety of angles. Also, what you learn in therapy gives you skills and insight to prevent depression from coming back. Some types of therapy teach you practical techniques on how to reframe negative thinking and employ behavior skills in combating depression. Therapy can also help you work through the root of your depression, helping you understand why you feel a certain way, what you trigger are depressing, and what you can do to stay healthy. Or antidepressants right for you. Medication can help relieve the symptoms of depression in some people, but they aren't a cure and come with the drawback of their own. Learning the fact about antidepressants and weigh the benefit against the risk can help you make an informed and personal decision about whether medication is right for you. Thank you for listening.